And thank you so much for participating in this. So you've got the Quervains of your left wrist, which you've had since the beginning of June, and
Yes.
it's been extremely painful, and your only relief has been a off-the-shelf splint.
Yes.
Okay, so you've come to me for an opinion and just some fresh eyes and what we can do to help you. So I'm going to use my little pendulum to assess the damage. Let's use your right hand as a control. So just want to show you. That's its movement on the right. Okay, so now we're going to go over to the painful left. And now you can see
That's the area.
that this is where it's much more painful. So you can see it's, now because it's circular, generally what I'm finding is that that's nerve related. So your Finkelstein test is negative. Can you turn your arm on the side? Yes, like that. And just rest your. So if it's tendon, generally from my observations, it will be vertical. So let's see. There we go. So this is the APL and the APB. And so I definitely feel you've got a combination of both nerve and tendon happening in this arm. Okay, so now I'm going to go higher up. I'm going to look at your radial nerve, and sure enough, your radial nerve is highlighting as problematic, and we've got the dorsal branch of the radial sensory nerve that's going down into that area. So let's just use the control. Let's use your left wrist. Nothing. Okay.
Yeah.
So now what we're going to do is we're going to do the treatment, and then we'll reassess.
Okay.
At this point here, we have actually got intersection syndromes.
Yeah, I can feel a bit there.
There.
Yeah.
Okay. So let's take our pendulum. Just ground it there for a moment. Okay. Yes. And it's not in a circular motion, it's now horizontal. So certainly tendon issue there. Sharon, so we've used the green light a lot on your heart actually, because we picked up there's some trauma happening, and the pendulum was swinging wildly from shoulder to shoulder, and it's completely calm. So now let's have a look. We've used the laser around your thumb, first dorsal compartment. It's still along the muscle belly. Sorry, I'm standing up, so I've moved the pendulum. So let's just go here. Along the radial nerve dermatome, it's completely still. So we've taken away that inflammation. Do you feel any difference?
I do feel a bit of like relaxation, if you know what I mean.
Okay.
So yeah, it's.
Can you move
calmer.
your thumb around? Do you feel as much pain?
Yeah, just down here.
Okay, we didn't
This
get to
area.
laser
No,
that area.
No,
All right,
but I can move my thumb.
much better.
Yeah.
Okay, let's laser that area.
Okay.
All right, so we're using the laser now on the volar aspect, and you can move your thumb without any pain.
Yeah.
It's all gone. Brilliant. So we had achieved excellent results after one application of the laser. So this is Sharon at her follow-up appointment. By this point, I'd done Kimberly Shipke's course, and I used a crystal to magnify the laser. So I placed the crystal at the end, and it's important to have a crystal with a point. And so this one is actually not the right crystal. I've got to import one from South America, and it also isn't big enough, but it's fine. I was using it, have been using it quite effectively. And so what I did was I placed the crystal over the thumb tendons with the point going upwards, because I'm actually wanting to transfer the energy up into the arm. And I then used a tuning fork and I actually applied the tuning fork to the end of the crystal. This further magnifies the impact of the light and the electromagnetic field. So it's important to remember that you're actually not needing to put the light on the skin per se. You're working within a field, and this crystal magnifies that field. And so we worked volally. We worked over the first dorsal extensor compartment, and then we worked dorsally as well. And these are her results.
My name is Sharon. I have been to Robin. I've had 5 sessions. When I initially decided to come, I had quite a lot of pain in my wrist. Some days it was unbearable, and as of today, I don't have any pain in my hands, so I'm extremely happy with the treatment that I've received. I think it's fantastic for me. For me, the green light therapy has worked wonders, and yeah, I can't complain. Just want to say thank you to Robin. You've really been a lifesaver. So yeah.